We have an environment where people are much more interconnected, so spread would happen faster, but on the other hand, there have been advances in science and technology that allow for maybe better care.
There would potentially be hundreds of thousands of people that would be seriously impacted.
Simplistically, if we had another flu epidemic similar to 1918, a lot fewer people would die.
If the influenza outbreak was to happen today, I think it's essential that we need to bring historians to the table because we can't really answer that question without having an excellent idea of what happened then.
I think one of the biggest issues of having a flu like that today would be the amplification of it by media that we have now that we didn't have then.
So historians can engage with the cultural and environmental drivers that trigger or might have to do with not only the emergence of the disease, but also with its diffusion and possibly account for the mortality.
And one of the things the GVP project is doing is trying to map the genomes of all the known pathogens that could potentially be contagious to the human population.
Our work is directed at trying to understand how drug-resistant malaria become drug-resistant, and then using that information to develop therapy that's more effective against drug-resistant malaria.
Basically, we're trying to understand the basic biology of a mosquito that is an important vector for viruses like dengue, chikungunya, and even Zika.
So the Center for Global Health Science and Security is a multidisciplinary research team that works on policies, plans, procedures that governments and other institutions around the world use to prevent, detect, and respond to public health emergencies.